Hi guys and welcome. Today we're going to be going over some basic anatomy of the heart along with the circulation of blood throughout the heart and in parts throughout the lungs. Uh, so we'll be talking about the four chambers of the heart along with the valves in between these chambers. We'll be talking about the great vessels and again the circulation of blood throughout these four chambers, the vessels, and the lungs. We'll start off here by first listing the four main chambers of the heart. We're going to start on the right side. The right side begins with the right atrium, followed by the right ventricle, the left atrium on this side, and lastly, the left ventricle. In between these four chambers, you have two valves here. Between the right atrium and the right ventricles, you have the tricuspid valve here on the right side, and then between the left atrium and the left ventricle, this valve here is called the mitral valve. Another name that it's known by is the bicuspid valve. Now, if you do call it the bicuspid valve, an easy way to remember the name of each one of these valves is you always want to try something before you buy something. So just like the valves here, tricuspid is before the bicuspid. Try before you buy. So those are the four chambers of the heart along with the two valves in between the chambers of the heart. Up next, we're going to be discussing the great vessels and the valves that are located between the chambers of the heart and the great vessels. Begin up here in the superior vena cava. This great vessel is the vessel that returns deoxygenated blood from the upper part of the body, the upper extremities, and the head. Up next, down here, is the inferior vena cava. Just like the superior vena cava, it returns deoxygenated blood, only it returns it from the lower part of the body, so torso and the lower limbs. Over here you have the pulmonary artery. This artery functions to transfer deoxygenated blood from the right side of the heart to the lungs where the blood becomes oxygenated. After the oxygenation happens, it returns to the left side of the heart, and that blood then travels to the aorta here, which is the great vessel that pretty much delivers oxygenated blood to the rest of our body. There are some valves also that exist between the chambers of the heart and some of these great vessels. Here you'll see the pulmonic valve. This valve exists between the right ventricle and the pulmonic artery, and its purpose is to prevent backflow of the blood during diastole, which is a phase of the heartbeat that we'll discuss in a bit. And the aortic valve here, I kind of had to draw it in for you guys. That's the valve that exists between the left ventricle and the aorta. Similar to the pulmonic valve, its function is to prevent backflow of the blood from the aorta back to the left ventricle during diastole. And again, we'll discuss the phases of the heartbeat, systole and diastole, in just a little bit. So I consolidated a few things here to give us a little more working room, but up next we're going to be talking about the circulation of blood throughout the heart and some of these vessels. We'll start on the right side of the heart here through the superior vena cava and the inferior vena cava. These arrows right here are showing deoxygenated blood coming or returning back to the heart from the body after oxygen has been unloaded from the red blood cells to whatever tissues they had to be unloaded to. As mentioned earlier, the inferior vena cava is the vessel that returns deoxygenated blood from the lower part of the body, so the torso and the lower extremities. The blood returns through here, deoxygenated, back into the right atrium. And similarly, the superior vena cava is where deoxygenated blood returns to the heart from the head and the upper extremities. Once the oxygen has been unloaded from the red blood cells, it comes through the superior vena cava or the inferior vena cava here into the right atrium, which is pretty much the beginning of circulation of blood flow in the heart. From the right atrium, the blood flow then continues onward into the right ventricle. This chamber, as you can see here, is larger than the right atrium, and the myocardium is slightly larger than the right atrium, and that's because it needs a little bit more force to work against the pressure that it'll be working against through this pulmonary artery. During systole, which is the contraction phase of the two ventricles, the blood is then squeezed from the ventricles. Here we're talking about the right ventricle here. The blood is squeezed from this right ventricle through the pulmonic valve into the pulmonic arteries, and it'll go either to the left lung or to the right lung, where magic happens and the deoxygenated blood gets loaded with oxygen and returns back to the heart. Here in the left atrium first, through the mitral slash bicuspid valve, and onwards on here to the left ventricle, which here you might be able to see is the chamber with the thickest myocardium. That's the muscle of the heart. Now, the reason why it's the thickest is because it has to work against the most pressure, and that pressure comes from pretty much the rest of our body. The right ventricle here, all it has to work against is the pressure of the pulmonic artery, which pretty much it's pressure given just from the lungs. Here, the left ventricle, though, it has to work against the pressure of our entire body, not just the lungs. So here from the left ventricle, blood flow will continue to move forward from here through the aortic valve, onwards to the aorta, and ultimately into systemic circulation. Pretty much it goes to the rest of our tissues throughout our entire body. It unloads that oxygen from the red blood cells, and the cycle starts over. Once the oxygen deloads, the blood then becomes deoxygenated, and it will return to the heart either through the inferior vena cava, the superior vena cava, and the cycle starts all over again. So as promised earlier, before I end this video, I'll talk a little bit more in depth about the diastolic and the systolic phase of the heartbeat. To kind of generally summarize things up, diastole is the resting phase of the ventricles. That's when the ventricles are not contracting, they are relaxed, and they are being filled with blood before the next phase, which is systole. During systole, the ventricles actually contract and squeeze blood out of their chambers through either the pulmonary valve or the aortic valve, and the blood moves forward onto either pulmonary circulation or systemic circulation. During diastole, as mentioned earlier, both of the ventricles are relaxed. They're not squeezing. However, here you see the right atrium and the left atrium are squeezing. The squeezing of these two chambers causes blood collected in those chambers to move forward, either through the tricuspid valve or the mitral slash bicuspid valve. It'll move forward into either one of the ventricles, and that is your diastolic phase. The atrium squeezes and the ventricles are relaxed in order to receive the volume that the atriums are trying to deliver to the ventricles. Next, we're talking about our systolic phase, which is pretty much the opposite of our diastolic phase. During diastole, the ventricles are at rest. They're open to receive volume from the atriums. This time, the ventricles are both going to be squeezing as pictured here. The right ventricle is going to be squeezing the deoxygenated blood through the pulmonary valve to the pulmonary system in order to get oxygen and then ultimately come back to the heart. And the left ventricle here will be squeezing, and the blood that's squeezing out will go through the aortic valve to the aorta and ultimately to systemic circulation. And that pretty much summarizes systole and diastole. Pretty much in regards to the ventricles, during systole, the ventricles are both squeezing, and during diastole, the ventricles are resting, but the atrium are squeezing, and they're squeezing blood to the ventricles pretty much just to refill them before systole, when the The ventricles will just squeeze that blood out again into either the aorta or the pulmonary valve. One last detail about diastole and systole that we'll discuss before ending this video is what the valves are doing during each one of these phases. I mentioned earlier in the video that the valves prevent backflow from either the vessels or from one of the chambers. That way, the chambers are doing their job and moving blood forward in one direction, and they're not allowing anything to go back. During diastole, we know that both the atriums are squeezing blood into the ventricles, and the ventricles are just resting, right? So as these atriums are squeezing, it makes sense that these two valves should be open. That's the tricuspid valve and the mitral/bicuspid valve. Blood is squeezed from the atrium through these valves, which are open, and both the pulmonary valve and the aortic valve should be closed. Now, during systole, we're doing the opposite here. The ventricles are no longer relaxing. This time they are contracting, trying to move blood forward through the pulmonic valve or the aortic valve. So these two valves should be open, the pulmonary valve and the aortic valve, and it would make sense for the tricuspid valve to be closed along with the mitral valve to be closed. Now that should typically be the case. However, there are diseases of the valves where the valves don't function correctly, so backflow occurs where it shouldn't be happening, and we'll get into detail in another video. But when those pathologies exist, that's when you start getting heart murmurs. There's systolic murmurs and diastolic murmurs that we'll get into details later on in the future. But that pretty much summarizes our talk for the day. We reviewed the anatomy of the heart, just the basics, the four chambers of the heart, along with some of the great vessels and circulation of blood throughout the heart. If this video helped you out, feel free to please give it a like, and also subscribe to the page, Nurse Maestro, and share it to your friends, any of your nursing student friends, whoever you think this might be useful to. Another thing you might want to do if you would like a PDF of any of these illustrations or of some of the notes that I used during this presentation, I will put my email down in the description below. Feel free to email me, and I will get back to you with a few of the notes and the illustrations used in this video. Again, thank you for watching, and we'll see you next time.